This week, Newfoundland and Labrador announced that mental health care services traditionally offered through the province's mental health crisis phone line will now be provided by calling 811. People needing urgent support for mental health or addictions needs can call the 811 health line to speak with a registered nurse. The province says switching to 811 gives residents an easier number to remember when they need help. During this transition, calls to the old mental health crisis line will be forwarded automatically to 811. Joining us now to tell us more about this new 811 hotline is Miss Kimberly Dawson, CEO of CMHA, Newfoundland and Labrador. Ma'am, welcome to Forum Daily.
Thank you very much, Nima. It's nice to be here.
So what services or support does this 811 hotline provide to those in Newfoundland and Labrador?
It really means that those who are in need of crisis response or mental health and addiction support can now dial a three-letter number, 811, day or night, and speak with a registered nurse trained in crisis intervention. So no one has to remember how to call a number, look up a 188 number, or even have to navigate a system. It's just, you can just call 811 right now.
And what types of services does this 811 number provide to residents in the area?
Any mental health or addiction support, also health support. So if you're in you need a crisis intervention or you need to talk to a registered nurse, you can dial 811 and someone's there to support you right away.
All right, and we are on the tail end of this pandemic after over 2 years of it. How has this pandemic impacted the need for mental health supports in Newfoundland and Labrador in particular?
I think a lot of people that don't normally struggle with their mental health are really struggling right now. It's the stress of living, working, and going to school in a COVID world. People are struggling with isolation, anxiety, loneliness, the unknown. They just don't have the normal social supports that you usually have, people around you to talk to and to share your struggles with. And I think here in Newfoundland and Labrador, the increased cost of living has been hard on people. People are struggling to make ends meet. The cost of gas, electricity, food is all going up, and that's very difficult on your mental health. We also have a shortage of housing and shelter beds are at capacity. I think most Canadians are emotionally overwhelmed and exhausted. You asked about the pandemic, and I just think that it's made an increased demand for housing, increased demand on our mental health and addiction services. We have long wait lists, and people are just struggling to keep up with the demand.
Some concerning information there, ma'am. Now, in many cases, the needs of people in the East or on the East Coast can differ significantly from those in other regions. So how do the specific needs of people in Newfoundland and Labrador differ from those in other provinces or territories?
Well, right now we have a lot of people living in rural Newfoundland and Labrador, so virtual services are good, but that can also prove to be a barrier if you don't have access to the internet and if technology or electronic devices or data plans are out of your budget. You also have to have reliable housing and something to support that connectivity. So virtual services are good if you have the capability to use them. And I think during the pandemic, it's been truly hard on seniors and people with low income. Here in Newfoundland and Labrador, we have a long waiting list for psychologists. We have a shortage of doctors that can make it difficult when people are struggling to get a mental health diagnosis and also getting the right medication and therapy.
Well, taking all of that into consideration, what other mental health resources are available for those living in Newfoundland and Labrador?
Well, right now we have a French and an English warm line that you can call through LifeWise. They formerly used to be Channel. We also have a Doorways program, which is a drop-in counseling service available throughout Newfoundland and Labrador, also available in rural Newfoundland and Labrador. We have online resources, Bridge the Gap, which is a tool for adults and youth. And we have Wellness Together Canada, which is the mental health help online program through the Government of Canada that we encourage people to access.
Just about a minute left here, Ms. Dawson, but it is Mental Health Week in Canada, so let's end this interview with a message. What advice would you give to those who maybe don't know where to start when it comes to taking care of their mental health?
It's an excellent question. Well, I think this year's theme is really good. It's a good place to start with empathy. We can all listen a little bit more and understand when something is coming, where someone's coming from. And it's okay to admit that you're not okay. And if you are struggling with your own mental health, know that you're not alone and that there are plenty of resources available to support you. Talk to your doctor or someone you trust and share what you're feeling and what you're going through. we all have mental health, and we really need to practice self-care and be gentle with one another and with ourselves. And let's be real and practice empathy in our daily lives, not just this week, but all year round.
All right, Ms. Dawson, thank you again for joining us today on Forum Daily.
Thank you very much. It's nice to be here.